Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province, and Dr. Werner Yu, President and CEO with AHS. Dr. Hinshaw will open today's update.
Thank you, Tom, and good afternoon, everyone. Before I get to today's numbers, I want to update Albertans about a change to the rules around mask exemptions due to medical conditions. Wearing face masks is a critical public health measure that helps prevent the spread of COVID-19. That's why we've recommended wearing them for more than a year, and why we've had a provincial mask mandate in place since December. Individuals are only exempt from wearing a mask in public places in certain circumstances. These include being unable to put on or take off a mask independently, if someone is eating or drinking while sitting down, if there is an occupational risk for wearing a mask, and other specific situations. In addition, there are a very limited number of health issues for which a mask exemption is possible. To help prevent spread and make sure that people are masking appropriately, we are clarifying what these health issues are based on best currently available evidence. These conditions are sensory processing disorders, developmental delay or cognitive impairment, mental illness disorders, facial trauma or recent oral or jaw surgery, contact dermatitis or allergic reactions to mask components, or clinically significant acute respiratory distress. Effective today, in order to verify that someone has a medical condition that makes them unable to wear a mask, Albertans with these conditions will require a medical exception letter from a health professional. This letter is important to have, especially if requested by enforcement officials for not complying with the legal requirement to wear a mask in indoor public spaces. Letters must come from a nurse practitioner, physician, or psychologist. More details about what needs to be included in this letter are available online, and guidance has been shared with the professional colleges of the healthcare practitioners who are authorized to write these letters. We are modeling this after the approaches already being used in Saskatchewan and Quebec, as well as resources developed by the Manitoba College of Physicians and Surgeons. This change is not meant to punish people unfairly. It's meant to ensure anyone who is capable of wearing a mask complies with this important public health measure, intended to keep us all safe, which is especially important during this third wave of COVID-19 in the province. Turning to today's update, we have now administered more than 2 million doses of COVID-19 vaccine in Alberta. Thank you to every single person who has gotten their shot. Please encourage everyone you know to be immunized. One of the most powerful ways to address vaccine hesitancy is hearing from someone you know and trust. Over the next 7 days, there are more than 328,000 appointments booked for vaccine. If you haven't yet been able to secure an appointment, please keep trying, as more openings will be added as we receive more vaccine. The response has been excellent, and I want to thank every individual who is choosing to be vaccinated. Your decision will make a difference in our collective fight against COVID-19. Over the last 24 hours, we have identified 1,558 new cases of COVID-19 and completed nearly 15,300 tests. Our positivity rate currently stands at 10.6%. There are now 722 people in hospital being treated for COVID-19, including 177 in the ICU. Sadly, I must announce that 9 new deaths were reported to Alberta Health in the last 24 hours. As always, I extend my sympathies to all those who are grieving the loss of someone they loved, no matter the cause. There have been some questions raised about how contact tracing is progressing during this third wave. The President and CEO of AHS, Dr. Verna Yu, will provide an update for you in a moment on this topic. Before we get to that, I want to remind everyone about the importance of self-care during this critical time. This pandemic has been long and very hard. Though each of our experiences through the pandemic have been unique, there is no denying that each of our lives has been affected. COVID-19 has taken from us many things over the last year. We have all missed marking important milestones in traditional ways. We have all lost out on a sense of normalcy in our everyday routines. And for many, the pandemic has had direct or impacts on our mental and physical health. The current restrictions in place, though, do not limit any access to mental health supports, including counseling, residential addictions treatment for those with substance use disorder, and mutual support groups. It's important for all of us to recognize that the pandemic has taken a toll on our mental health. Recently, Canada's Mental Health Week promotions encouraged each of us to get real about how we feel by naming, expressing, and dealing with our emotions, the ones we like and the ones we don't like. Naming or labeling our emotions can help us understand and process them. However, if your emotions are overwhelming, persistent, or interfering with daily life, or if someone you care for is experiencing this, it is important to seek mental health supports. Help is available, and there are safe ways to get the care you or your loved one needs. A list of resources and contact information is available on ahs.ca/help-in-tough-times. No matter what we face, we must remember that the enemy we are fighting together is COVID-19, not each other. Please be kind and respectful to those around you, whether the cashier at your grocery store, the bus driver on your daily commute, your co-workers, neighbors, friends, and family. They are all dealing with the worry and stress of the pandemic the best they can. And you can make a difference by extending them the grace and understanding that you would like extended to you. We need each other. No one can do this alone. Thank you, and I'll now invite Dr. Yu to update you on the contact tracing system.
Great, thanks very much, Deena. Good afternoon, and thank you for the opportunity to join you today. I will provide an update on contact tracing, and we'll start by saying that I'm very grateful and proud of all the teams working to contact Albertans with potential exposure to COVID-19. Our teams continue to contact and investigate all COVID-19 cases within 24 hours of receiving confirmation of their positive test results. This has been happening since January the 9th and is the result of significant investment and recruitment in contact tracing. Our priority has been and continues to be contacting and completing initial case investigations with all new COVID-19 cases. Within the last 7 days, our investigators have been able to reach COVID-positive cases via phone calls within 12 to 24 hours of receiving their positive test results 80% of the time. Yesterday, as an example, we closed 1,800 investigations. Our second priority is reaching close contacts. Once cases have identified their close contacts, they are immediately contacted with quarantine and testing instructions. At the end of April, we modified our case investigation approach to maximize our ability to contact Albertans during a pandemic as case numbers rise. One of these changes was stopping the notification call AHS would make to workplaces notifying them of a positive case. We are now requesting COVID-positive Albertans to let their employers know they had tested positive for COVID-19. If additional close contacts were identified at the workplace, they are notified of quarantine requirements. If multiple cases are linked to a workplace, our COVID-19 outbreak team investigates. We continue to prioritize high-risk workplaces for outbreak investigations. These workplaces include continuing care, long-term care, designated supportive living, acute care, correctional facilities, shelters, work camps, workplaces where individuals work in close proximity for extended periods of time, food processing plants, warehouse distribution, and manufacturing facilities. Contact tracing in Alberta is a partnership, and it is a shared responsibility between Albertans. We must all work in partnership to keep focus on early and timely notification of close contacts. To that end, we have created a suite of online tools empowering leaders, schools, community groups, and businesses to help collect and provide contact information for their staff, patrons, and students in the event that we need that information for contact tracing purposes. These partnerships have helped our contact tracing team immensely to identify and contact individuals who may have been exposed as quickly and efficiently as possible. This strategy also frees up our staff to be able to do case investigation calls. We will continue to modify our approach as needed and use the systems and strategies that we have in place, such as text, email, and close contacts tool to do all that we can do to contain COVID-19 spread in our province. As you've heard me say before, AHS has been aggressively recruiting to the case investigation and contact tracing team since the start of the pandemic. Our current workforce is about 2,550 case investigators and contact tracers, which is 50 times higher than our original team of 50 contact tracers in March of last year. As we talked about, we've partnered with companies such as WestJet to hire staff who have been furloughed. We've also hired new Canadians and worked with foreign-trained physicians to engage them in this work. We continue to hire, train, and onboard staff to increase case investigation and contact tracing capacity. We continue to regularly assess our recruitment needs based on the evolving needs of the pandemic response. We now have the capacity to increase the size of our case investigation and contact tracing team based on demand. With aggressive recruitment, tools and strategies in place, and existing partnerships, our team is robust and is keeping up with current case numbers. Thank you.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
The first question comes from Carrie Tate of Global Mail. The line is open.
Hi, thanks for taking my question. This is actually for both of you. I'm wondering if there's room for pop-up hotspot clinics in Alberta's vaccination plan, if that's something you think would be helpful.
Sure, I'll maybe start, and then Dr. Yu can add anything further. Making sure that we offer vaccine to every Albertan who wants it in a way that is as low barrier as possible is absolutely something we're looking at. It's important to know, though, that we have a finite amount of resources in terms of the vaccine that we have available, the professionals who deliver it, and the infrastructure that's needed to make sure that vaccines are within cold chain, that there's appropriate and prompt monitoring and reporting of vaccines administered. And so right now, while we have extremely large volumes of vaccine coming into the province, we are wanting to make sure that we are maximizing the efficiency of our delivery and as much as possible supporting people to go to those locations that are nearest to them, which include pharmacies, some physician offices, and the Alberta Health Services clinics. We are looking at areas where perhaps uptake and coverage is not as high as we would like. And it's in those particular areas where the possibility of outreach clinics could play a role, but we need to make sure we're looking at that from a provincial perspective and making sure that we are considering all those who might benefit from it, as well as not diverting resources from the clinics that are providing access to the majority of Albertans. So it is a balance, and we are looking at both options. Dr. Yu, is there anything you'd like to add?
No.
Carrie, is there a follow-up question?
Yes, thank you. Premier Kenney and Dr. Hinshaw, you've repeatedly talked about how Alberta is at risk for having high vaccine hesitancy. You've talked about how there's an ad campaign coming. Can you be a little bit more specific about what Alberta intends to do to reach vaccine hesitant citizens?
It's important to know that the term of vaccine hesitancy is a very broad one, and so there are lots of reasons why people might be wanting perhaps more information, perhaps there's barriers to uptake, And so what we're doing right now is working with our teams to look at best current evidence on dealing with different aspects of what people might need to feel comfortable to receive vaccines. And some of that might be more information. Some of that might be the motivation about what is the benefit of receiving a vaccine. Some of that might be more logistics and how we can eliminate the access barriers that might exist. And so that plan that we're working on takes into account all of those different components and looks at our data. Where are those areas where we are seeing perhaps lower coverage, where those particular groups of people could be offered the benefit of perhaps, as I mentioned earlier, outreach clinics or other ways of accessing those individuals to make sure that they have the most reliable information provided to them in a way that's easy for them to access, whether that's through partnerships with people that they trust, local leaders. So again, there's no one-size-fits-all approach. We need to make sure that we're thinking about how people want to receive information and services, providing that in the best way possible across the province.
Operator, could you put through the next caller, please?
Julia Wong, Global News. Hi, this question is for Dr. Hinshaw. I'm curious why there's a need for this medical exception letter now. We've had a mandatory mask mandate for many months now, so is this because you're seeing people not wear masks, seeing more people not wear their masks, or is this because there's going to be more specific enforcement about this?
We've been in discussions with our teams for a while as we've seen again, some of the reports that have been conveyed to us by our teams on the ground, and as well, obviously, there have been some incidents reported in the media where individuals who are not following public health rules are perhaps seeking loopholes or areas in the rules where it's not clear, and that's sometimes challenging our local law enforcement teams to be able to remind people of the importance of following these rules and the fact that they are not optional, they are mandatory. And with the feedback we've received about how we can make our public health orders more enforceable, this is one of the things that we've heard is going to be effective at supporting our frontline enforcement teams to be able to verify when people do have a medical exemption and to make sure that when people are able to wear a mask, to protect those around them and to provide some degree of protection to themselves, that they are doing so in a manner that's consistent with the rules set out in the public health orders.
Julia, is there a follow-up question?
Yes, there is. Thank you. And on a slightly different topic, positivity rates in the province are still quite high, but cases haven't been over that 2,000 threshold for a few days now. Where would you say we are when it comes to the third wave, and what can we expect?
I think that it's a bit soon to make a final declaration. As you mentioned, our positivity rates remain high and have been 10% or greater for some time now. The number of daily cases is a factor of both the positivity rate as well as how many lab tests are processed, which again is a factor of how many people are presenting for testing. So I think right now, while our number of new daily cases has declined somewhat, I think it is a little early to say that we are definitively past the peak, but I do think it is encouraging that our positivity rates have not continued to increase. And so again, we're just watching closely, and I think we're in a time of hopefully turning the corner, but it's very, very much too soon to declare that this is indeed behind us. And I think, again, we'll see in the coming week what those numbers look like as our testing typically increases throughout the week, decreases a little over the weekends. So our Sunday and Monday numbers are typically a little bit lower. So I think, again, over the next week, we'll be able to see whether or not we remain at a very high plateau or whether indeed we have turned a corner and our cases are declining.
Operator, could you put through the next caller, please?
Matt Woodman, CTV.
Hi, Dr. Hinshaw. I have a question for you regarding nonprofit summer camps. Will they be able to operate this summer? And if so, when will you provide these nonprofits some guidance about timelines and potential health protocols? Thank you.
One of the most difficult things about this pandemic, I think, has been the difficulty in being able to plan with certainty, particularly planning for things that are taking place in several months' time. I know that those who operate overnight camps who weren't able to operate last year need to have information soon to be able to make decisions about hiring staff, whether they're going to be running programs. And at the same time, it's very difficult to give any direction with certainty. So we continue to work with different stakeholder groups, including those who operate these kinds of camps, and unfortunately have not yet been in a position where we can provide that level of definite certainty. I know that their deadlines are approaching soon in terms of if they're not able to make plans soon, that will impact their summer. We're aware of that. But again, the challenge is that right now we continue to see extremely high case rates. While we are seeing again, hopefully some early indications that perhaps our numbers are declining, our hospital and ICU numbers continue to go up. And so we need to take all of those things into account as we're considering what the summer might look like. And so again, I regret the significant impact this is having on people who need to make plans for the summer, but we simply don't know with certainty what the summer will look like yet.
Matt, is there a follow-up question?
Yeah, just an unrelated question, actually. We just got a statistic out of BC that says more than 98% of that province's recent COVID-19 cases involved people who were either unvaccinated or they had been recently vaccinated, so the antibodies hadn't built up in time, according to health officials. I was wondering if there's any statistics like that available in Alberta. Do we track that kind of stuff?
We are looking at our data and working on vaccine effectiveness calculations to be able to provide some of that information with Alberta-specific data, but that analysis isn't yet complete, so that will be coming at some point soon when we're able to complete that analysis.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Lauren Boothby, Edmonton Journal.
Hello. I have a question for both of you on contact tracing. So how many people have you hired since last year? Have you reduced the number of people that were working from your initial hiring boost, or did you not end up hiring everyone you expected to? What's happening with that?
So maybe I'll take that question. So as I mentioned, prior to the pandemic, our regular workforce for contact tracing was 50 people, so that's 50. Right now, current as of yesterday, we have about 2,550 people that are actually currently within our workforce. We are constantly looking for recruitment and making sure that we have enough people on staff to be able to adapt and adjust, because as you can tell, the pandemic really is difficult to sort of predict sometimes what the needs are. So we are continuing to, as I say, recruit. And the numbers right now, as I said, are over 2,500.
Lauren, is there a follow-up question?
Yes. So this is for Dr. Hinshaw and Dr. Yu. So Dr. Hinshaw said earlier this week that there are positive signs the spread of COVID might be dropping because of our values. But how confident are you that health officials have an accurate view of where we are right now in the pandemic? With the contact tracing system tax, you're not testing all positive cases for variants. Now we're leaving it up to employees to tell their bosses if they test positive, which might be a scary prospect for some, and workplaces and schools as well. So to what degree are we in the dark, or are you confident that we know where we are with the pandemic right now?
With respect to the R value, our positivity rates, and the number of new daily cases, those are metrics that rely on the number of people who present for tests, the number of tests processed by the lab, and that's really all that those particular metrics rely on. Our lab has maintained a very high capacity for testing throughout the pandemic, and you may recall likely about a month or more, perhaps about 6 weeks ago, we made a shift to not offer double testing for all of the close contacts of cases. We know that the second test in somebody who was asymptomatic and had a negative first test had an extremely low positivity rate. And so dropping that particular test did not impact our ability to find cases in a significant way. And so over the last several weeks, those particular metrics, R-value, positivity rate, and new cases, have not been impacted by any policy change. Those particular metrics are not impacted by any updates that have been made to the contact tracing protocols. And so with respect to how comparable those numbers are from 1 week to the next, those numbers are absolutely comparable. We know it has been true throughout the pandemic that we capture approximately 25% when we look at our serology data of the positive cases. So there are more positive cases than we will be finding with our testing. However, again, that has been relatively constant throughout. And so I believe that as we're looking at trends, we are looking at reliable trends over time, and comparing 1 week to the next does give us an indication of where we're at as the pandemic progresses. But of course, what it tells us is only, again, these snapshots in time, and we do need to wait for another week or so before we can determine whether or not the more recent changes in our case counts are part of a declining trend, or whether or not it may be more of a short-term plateau. So again, that I can't say, but I don't believe that any of the adjustments that have needed to be made in the contact tracing process will have had any significant impacts on those three metrics that I mentioned, which are our key leading indicators.
Operator, could you put through the next caller, please?
Lauren Poulin, Globe Calgary.
Hi, this question is for Dr. Hinshaw. Thanks for taking the time to answer my question this afternoon. You had said earlier last week that earlier second doses are very likely probably not going to have to need that 4 months between doses as the maximum. Can you provide any further details on that? What does the province need to see with phase 3 vaccine offerings before it does move on to second doses? What is the threshold to move on to second doses?
Sure. What we want to see is that the vaccines that are coming into the province are moving into the arms of Albertans who want them as quickly as possible. As I mentioned earlier, we've had very good uptake from the populations that are currently eligible, and we want to make sure that we're maximizing offering vaccine, that first dose of vaccine, to all those who want it, and to be able to provide that to as many people as possible, because going from having no protection to having that first dose, which again offers approximately 70 to 80% protection, is a very important boost. We also want to be able to offer second doses, which move people from around that 70 to 80% mark up to about 95%. We want to be able to offer that boost again as soon as possible after we have completed the first offering. So we're going to be watching closely to see when our uptake begins to slow in those populations who are eligible for their first dose. If our supply of immunization speeds up, or our supply of vaccines, then again it's a balance of making sure that we're opening up eligibility as soon as we have the supply to do so. And so again, my estimate would be that by early June, I would believe that we would be able to start offering second doses if our supply arrives as we expect it to, and if the demand continues as we expect it to for first doses.
Lauren, is there a follow-up question?
Yes, thank you. On a bit of a different topic, it has been several months, I believe 5 months, since Albertans were told that they would be able to get sector-specific transmission data, and it still hasn't been made public yet. Several sectors who have been impacted by these closures are continuing to call for this information to be made public. Do you have any specifics for us today, or when will the province release this information?
It's a good question, and our analytics teams have been working on multiple fronts. As you know, there's a lot of need to have accurate, up-to-date local immunization data, and they've been working on that, providing those analytics to our immunization program, as well as doing analytics on the third wave and all of the significant challenges that we've faced in this particular wave of COVID-19. So unfortunately, as our analytics team is a limited group of people and they're doing a lot of work every day, some of the reports that we had been working on preparing for public release have slowed down a little bit, and one of those is unfortunately that sector-specific report. What's really important to remember, though, is just like in November and early December, with what we're seeing in this third wave, is that when we reach a point of extremely high transmission, we get to the point where every time people are in close contact with other people, especially in indoor environments, that chance for spread is out there across all sectors. And so it's not any one single specific sector that by itself is contributing the majority of spread. It is across all sectors, which again is why we need our current measures to be able to drive down transmission, to drive down those risks, and to be able to get to a point where the vaccines can have the impact we want them to have in terms of protection.
Operator, could you put through our final caller, please?
Kevin Mimic, CTV Calgary.
Hi, Dr. Hinshaw. Schools are supposed to go back to in-person in less than 2 weeks, but we're still seeing alert or outbreak status at nearly 40% of Alberta schools. Will students be sent back to classrooms?
The decision about in-person learning is one that the Ministry of Education has made based on operational considerations of the number of individuals, both students and staff, who needed to be in quarantine following exposures based on the high level of community transmission. And so decisions around the return to in-person learning, again, would be best directed to the Ministry of Education. What I can say about the alerts or outbreaks that are posted online is that those alerts or outbreaks are there based on the exposures that would have happened prior to the move to remote learning. And so when we look at, again, the decisions about whether or not students will return to school in person, we will also look at those outbreaks and alerts, because typically we wait 4 weeks before declaring an outbreak over if there's a possibility of ongoing transmission. However, with all of these locations having moved to online learning, there may be an opportunity to use that pause as a chance to reassess whether or not we need to keep those schools in alert or outbreak status, again, because the opportunity for that in-person transmission has been eliminated through the 2-week pause.
Kevin, is there a follow-up question?
Yes, Alberta Health is reporting variant cases, but is not testing all the positive COVID-19 cases for variants. Are the variant numbers you're announcing misleading?
What we needed to do, and you'll recall this was announced a few weeks ago, with the increasing number of total positive COVID-19 cases, we needed to make sure that our lab capacity was dedicated to the work that would make the most difference in preventing COVID-19 transmission, which is ensuring that anyone who goes for a COVID-19 test gets the results of that test as quickly as possible. That's our #1 priority. And the lab did not have sufficient capacity to be able to do daily screening for variants on all positive cases at the same time as turning around those COVID-19 results as rapidly as we need to. And so we made the decision to move to an approach that most other provinces, I believe all other provinces, had moved to weeks before us, which is to use a sample of positive cases that are representative of geographies, of different age groups, of different locations, and making sure that we are selecting high-risk particular contexts for screening and testing for variant status. So we are looking at ways to represent that data given the shift from screening all positives to screening a representative sample. And so we're able to show Albertans the proportion of our cases that are screened that have that different variant status, which again, because we're selecting a representative sample, would be assumed to be a snapshot of what you could assume would be happening in the entire population. So we're using a different methodology now, again, given the need to allocate resources in the lab in the way that makes the most difference to COVID-19 control. And again, looking at the best ways to show the results of that shift, but it is representative of all of the cases in the province.
Thank you all for joining us. Dr. Hinshaw will provide another live update early next week. Have a safe evening.